You don't advertise a party, celebrate the turnout, and then blame the guests for overcrowding the house. Population growth didn't happen by accident. Hello everyone and welcome back to the channel. Alberta's healthcare is now a citizenship club, according to Premier Daniel Smith. Today we're going to examine a contradiction. Premier Daniel Smith and the UCP government want to put forward a referendum question that only citizens and permanent residents should have free access to Alberta's healthcare system and that everyone else should be charged a fee. Visitors, students, work permit holders, and protected persons. Their justification? Overpopulation, strain on the healthcare system, strain on the education system on the verge of collapse. But here's a problem. The same government that now blames population growth actively invited that growth. And today, we're going to walk through that contradiction point by point. Premier Smith and the Alberta government actively sponsored ads, including billboards across Canada. Alberta is calling. Move to Alberta. Lower taxes, more opportunity, better life. That wasn't the federal government. That was the UCP and Daniel Smith. They celebrated record in migration. They framed it as economic success. They used the numbers as proof that Alberta was winning. Now suddenly, those same numbers are evidence of a crisis. You don't advertise a party, celebrate the turnout, and then blame the guests for overcrowding the house. Population growth didn't happen by accident. It was encouraged, marketed, applauded. If the system is strained, the question isn't who showed up. The question is who planned for it. Now let's talk about money, because this entire proposal is framed as financial necessity. Non-permanent residents pay income taxes. They pay CPP. They pay EI. They pay GST. They pay rent. They buy groceries. They support businesses. International students often pay higher tuition, inject billions into the economy, still work part-time jobs that are taxed. Temporary foreign workers feel labor shortages and pay full deductions. And here's the inconvenient truth. Some non-permanent residents contribute more in total tax revenue than some citizens. Contribution is tied to income, not to a passport. So how exactly do you justify taking someone's taxes on Monday and charging them extra at the emergency room on Tuesday? That's not fiscal responsibility. That's selective accountability. Healthcare in Alberta is publicly funded. It operates on collective contribution. It is not a loyalty program. It is not a tiered membership service. If the system is strained, and yes it is, we need to talk about physician shortages, hospital capacity, management decision, infrastructure lag, federal, provincial funding negotiations. Those are structural issues. But framing the crisis as non-permanent residents as the problem is politically convenient. It shifts focus away from policy design. It redirects frustration. It creates a target. And it avoids one central fact. Planning for growth is a responsibility of government, especially when the growth was actively encouraged. Let's be clear about what this referendum question does. It draws a line. It separates people into categories. It sends a message. You are less entitled. That may generate political momentum among frustrated voters, but it does not solve emergency room wait times. It does not build hospitals. It does not recruit doctors. It does not train nurses faster. It simply reallocates blame. And the contradiction remains standing. You cannot champion record migration as economic victory and then portray migrants as the root cause of collapse. Leadership means owning both sides of the equation, not just the applause lines. If Alberta's healthcare system needs reform, let's reform it. If funding models need adjustment, let's deliberate them transparently. But dividing taxpayers based on immigration status after inviting them to contribute to this province is not structural reform. It's political positioning. Alberta opened the door. People walk through it in good faith. You don't roll out the welcome mat and then charge admission after they've moved in. Accountability starts at the top, and that conversation is long overdue. I will see you in my next video.